Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Today we're going to be talking about coronary artery disease. And joining us for this important discussion is cardiovascular thoracic surgeon, Dr. Vernon Dencklau. Dr. Dencklau, welcome back to Today's Health.
Thank you for having me.
Always like to start at the beginning. What is coronary artery disease?
Coronary disease is a process where atherosclerosis affects the arteries supplying the heart muscle with circulation. Atherosclerosis is a disease whereby the very nice smooth inner lining of the coronary arteries gets replaced by other materials. It can be either rock hard calcium, or it can be more of a gristly material, or something very mushy, almost like a paste.
Well, so we can really understand what we're talking about here. Can you tell me a little bit about what does the heart look like and what does it do?
I've got a little diagram here that gives you a little bit of about the idea of the heart function. The cardiovascular system is essentially a transport system, essentially with pipes or tubes that transport blood, the heart being the central mechanism that actually provides the propulsion. So blood returns to the heart through these, which are veins, called the superior and inferior vena cava, which then go into the right side of the heart, which is the smaller portion of the heart, the right atrium and right ventricle. The right ventricle pushes blood then through the lungs, where it's given oxygen. From the lungs, it goes back to the heart, to the left side of the heart, the left atrium and ventricle. The left ventricle, which is the larger, more muscular part of the heart, then pushes blood to the rest of the body.
Well, and it looks like those coronary arteries are sitting on top of the heart. Is that correct?
Yes, and that's why we'll talk about it a little bit later when it comes to the treatments. The coronary artery sitting on the top makes our treatments somewhat more easy, but it also, as this diagram shows, the arteries that are affected are the arteries on the surface of the heart that become plugged, depriving the heart muscle of circulation. And just like an engine, when you pinch off the fuel line, that heart muscle cannot function properly if it does not get the proper oxygen and nutrients.
How common is coronary artery disease?
Coronary disease is the leading killer in our country today. Over 16 million Americans suffer from coronary disease. And in spite of other diseases that have a lot more notoriety, coronary disease kills more women than anything else.
Are there some people that are more at risk than others to get coronary artery disease?
The risk factors for coronary disease, in order of somewhat of an order of importance or prominence, number one is essentially heredity. You can't change who your parents are, but there is a genetic predisposition, which is why on occasion you will see people who are otherwise looking like fit specimens who can get heart attacks. But the things that we try to focus on, because they are things that you can change, are the other effectors, which include smoking, obesity, diet, and a sedentary lifestyle, diabetes and hypertension. And obviously diabetes has a direct correlation in some people to their weight.
So what actually causes this plaque or whatever it is to build up inside of the arteries?
We don't know specifically physiologically, but what I can tell you, we have a little diagram here also. And what happens is, as I said, this nice smooth lining gets filled with other materials. And it is a bit of an inflammatory process, and what happens is this disease process builds up and actually pinches flow, just like pinching the fuel line going to your engine. And as it progresses, it can go from just making the heart muscle not function well, giving you symptoms, to depriving the heart muscle of circulation enough that a heart attack is created.
Can you prevent coronary artery disease?
Coronary disease cannot be prevented entirely, but what you can do is significantly change your odds for getting it. You can't, as I said, change who your parents are, but maintaining a healthy lifestyle. By healthy lifestyle, we mean maintaining as close to an ideal body weight as possible, watching the diet, not smoking, not doing things that provide those risk factors.
Because the problem happens over time, is that correct? It doesn't just happen all at once?
It does progress as time goes on, or can, especially if we don't change the risk factors. But the symptoms can come on abruptly. Okay. In fact, 1 out of 10 people with coronary disease, first symptom is sudden death.
Wow, that's pretty sobering. Time to take a break, and we'll come back. There's lots more to talk about.